Okay, let me just check that that's recording. We can delete some of this. Yep. How do I look? Looking good. Yeah. Okay, so what you say?
Right elbow and left toes.
This is your left, this is your right.
Right elbow, left toes.
Where is your elbow pain?
Just in the joint, just there.
Okay, so between large intestine and Sanja.
Yep.
So if I press on that.
Ow!
Right, so you saw that face. Okay, so that's a score of 10.
Mm-hmm.
Left toe, big toe?
Yeah, on the medial aspect.
So this kind of...
Actually go more lateral, sorry. Kind of that side of the joint.
This?
Further down. Distal.
Oh, sorry.
Yeah. Ah.
Yeah?
Ah.
Okay, that's 10. So, we have our reference score. I think we'll make this a fast and furious treatment. Digestion is okay?
Mm-hmm.
Okay, so round 12. I'm not even going to mark the points. I'm going to use the needles to mark the points. Because that's what I often do when I'm doing a busy clinic. And I'm going to use bringing Qi home because of your chronic condition. It's okay to talk about your chronic past illnesses. So just locating top of the pubic bone, sorry Liv, which is there. So halfway, and then back some, and you can see the depression of Ren 4. Do you prefer if I roll the needles or?
Mm-hmm.
So there's Ren 6, halfway between. I'm going to give you stomach 25 and spleen 6. So this is 6th one, so 2 or divided into thirds. Here's stomach 25. And then I'm going to start looking for Qi points. Okay, so your elbow is going to be, that's stomach 24 area, that's shoulder. Elbow is going to be around here. Straight away I feel a little something here. It's like a little, there's a little thready bit. Is it going up either direction from the elbow?
Only when I lift.
Okay. Is it going right up to your shoulder?
No.
Okay, well we might get away with just doing around the elbow point, and this is where I feel. Which might, actually, you know what, I will use a surgical marker just. So I'll go with that as shoulder. So my palpation is quite gentle initially, because it's like the upper part of the elbow, it should be more superficial. And I'm finding like a little thready bit, probably around there, which is a bit high, but because it's the lateral part of the elbow, I'm not worried about that. Maybe it's here. So I'm going to go straight for it. Let's see what kind of results we can get. So I've already got an idea and I have like a memory of where I was feeling stuff, so on occasion when you have a needle in, it can be difficult to get an accurate idea of where Ashi points are. So get your little exploratory survey done first. So, Liv, do you want to just check that that elbow now, or will I? That's still right. And what level is that at now?
8.
Does it feel a little deeper, or?
Yeah.
Okay, so I'm just going to, before I add more, I'm going to adjust the depth. So it's a little bit deeper, but I expect it to still be at a relatively shallow area. How's that now?
2.
2? So that was that much of an adjustment. That much of an adjustment. And I'm going to let that sit and then I'm going to come back to it. I haven't even fixed these needles yet. So it's the left toe. And again, I will just mark out. So if this is round 7, then stomach 26 is going to be in around here. This will be the knee. This will be the ankle. So you can see I'm really guesstimating. And again, straight away, I'm hitting it here and I'm going straight for that. I'm not going to flute around. And because it's the big toe, it's right outside of the turtle shell, so I'm going superficial. I'm going to see what the response is. Okay, so that's still at what?
5.
Okay, so it's down to 5. Now I'll just go a little bit deeper and give it a little bit, because there is a bit of resistance, not a whole lot. How's that feel now?
Still there. About a 3.
It's about a 3. I was probably pressing harder there than... Okay, I'm going to use another little Ashi point. And there is a bit of resistance there, so I'll be pretty confident that that'll shift it.
It's still a 2.
Still a 2? Okay. Right, well I'm going to fix the depth of the like scaffolding or foundation points. I'm going quite deep with these to really reinforce the kidneys with spleen qi. Prenatal qi with postnatal qi. Okay, let's see if that makes any difference. How's that now?
It's down to a 1.
Okay. And the elbow? Do you want to just move it and...
It's still verging on a 2. It's kind of really close to the joint space. Yeah, just
There?
yeah,
Okay.
kind of bony.
Okay, right, well, tell you what, I'll add one more Ashi and then just check that again if you wouldn't mind.
Mobility's down to 1. That's good.
Yeah? And the toe?
It's down on a 1.
Alright, well 90% improvement, I go with that. What was that, 5 minutes? Actually it was a bit more. It was about 7 minutes. So, that's how fast it can be. If you don't get the results with that quick initial treatment, you could do more comprehensive. I suppose I'm just showing how fast it can be when your palpation skills are quite zoned in. Would you like me to do any more? I mean, that's pretty comprehensive anyway. Twinkle toes. Okay. So, do you want to smile for the camera? Okay. That's it. Hopefully that worked.